Welcome to HIMSS TV. I'm Laura Levitt. I'm the managing editor at Moby Health News. Today we are very fortunate to have Abdulaziz Alkhlaif, the Chief Information Officer at Dr. Abdul Rahman Al-Mishari Hospital in Saudi Arabia. Thank you so much for joining us today.
You're quite welcome. Thank you for having me.
Let's just start off talking a little bit about the COVID pandemic. How has that changed the way that you work? And, how has it been a catalyst for digital transformation?
The pandemic as a whole is hitting the globe in so many aspects and changing the way that society are interacting, the way that services has been provided, the way that we interact with each other, and our all type of technology and tools in the workplace, especially in the hospital. So it was quite challenging at first to adjust to all of those changes at once. And so we did go through a period of, rallying together, making sure that all of the leadership in the hospital are aware about the situation, aware how to affect the service delivery in those layers, and then, trickling down to the next layer and so forth. So from the first initial hit that we encounter with COVID, changes in the way to deliver services was the biggest impact that we faced. The next one was our ability to derive or to deliver that services. So our care provider need to, that time needed to reassess the way that they are dealing with the patient and the delivery of those services. A lot has been executed at the time in quite rush. We have to reiterate once and twice to cover what the continuous finding on COVID when those guidance do the first thing that was discovered. So it was quite short, but it really showed the fabric of those people working in healthcare. It really shows that they are in that manner already equipped in their mindset to deal with those situations. We found that adopting new systems, new technology was quickly accepted. That was a plus, and that was in that time, but it really took some effort from all layers of those care providers to deliver those services. We thought that first we will choose the most vulnerable patient to deal with. Those are with managed diseases, chronic diseases. So we extended our care to their home using telemedicine, using other even by call by phone, as those technology we needed to adopt quickly. Like telemedicine. So we took us a couple of months to get ready, but we eventually, alhamdulillah, thank God, we were able to adjust.
Oh, interesting. Moving on to sort of that patient care and patient experience sort of aspect, in your opinion, what will be the optimal way to build the patient's experiences and access care for generations of portals and applications?
That query is very close to my heart. I think one of the most important ways that we could make the access for care more accessible, more human, is to really visit those moments when the patient or those customer or seeking healthcare will be in need. So if we understand those moments and rebuild the whole experience that they are getting from a portal or an application, we will be in better place. That being said, when you are looking at those moments of interaction between us and the patient, we're looking to augment their life so they will be more in control. So we're empowering them to use that new technology, that portal, that app, or whatever it is. And that power of that layer of information need to be powered by an AI that will really act in the best interest of the patient, acting as an advocacy for that patient need. So every individual patient have their need for their situation, for their different case and their different illness. So reassisting the whole design of that interface and accessibility need to come into a higher level of understanding of the situation. And what better to understand it that a dedicated, best in breed, dedicated service for or AI that will assist that patient to really get the best of the experience between him and whatever care provider that they implement. Something like reminding for what is the check, reminding for medication to be taken, situation that really suited for him as we understand more about his situation as a patient, for clinical care, for allergies, for other stuff. So we are moving for more customized care in that particular, but we are not burdening our own care provider to extend their care outside the organization. We're using that systematic way of gathering this information and then acting on it. And that is a key, I think, for the future.
You touched on this a little bit, but could we talk a little bit about data and how are you using data to sort of propel care in the pandemic and using that to sort of address issues coming up with COVID-19?
Yeah, I think that one of the pillar of building anything right now is having the most accurate data that we could get. And to get there, we have to interpret the data the way that I understand it and you understand it and other body understand it. So that standardization of that piece of information that each of us are interacting with and reading is a key aspect of any improvement in the future. Even if you're employing an AI or a decision support systems, you need to have that meaning consistent across different silos, across different setting. So making sure the standard of data is there and usable for and understandable from all disciplines is a key aspect of moving forward on this revelation of moving for more connected care, more understood as a situation. So right now, I think the biggest challenge that we are facing is making sure that the data across the board is understood and collected in the same way. And I see a lot of movement from the government here to standardize that by having a dictionary for each aspect or each type of information. Now, that type of approach is an excellent way. Now, we need to have ways to adopt it. We need to make sure that we understand how to utilize it and we'll embed it inside our own systems and tools.
Now, sort of looking ahead, what are you most looking forward to in the next few months in terms of healthcare and healthcare developments?
Well, I'm very optimistic in the coming future. I really would love to see more of understanding and making sure that everybody is aware about those emerging technology. We like to move away from having the tech world understand the technology and then business world are just struggling to understand what is the use case for this type of technology and so forth. So I'm really looking forward to align that language between the two disciplines, making sure that when we are adopting any of those emerging technology, mainly one of the top is AI, is that it's come with a use case, a business case from the side of the business, saying that I like to see how could we achieve that with using this technology or this tool. So that would be a huge, dream from my side to make sure that it's not only the tech side or the technology side is going and driving all of this. It's going to be use cases. It's going to be business cases. It's going to be a benefit, value driven from the side of the business, saying that if we could adopt this, if we could switch it, build it in the way that we think that it will serve us more, and then it will be released for the tech side, and then we could achieve that goal. That harmony between the two sides would be, optimally what we're looking for.
Thank you so much. This is so interesting and just a great perspective on what's happening in healthcare and how it's been impacted by everything going on in the world right now. So thank you so much for coming on.